and welcome to Round Robin. I'm your host, Robin McCormick with the City of Hampton, and today we're going to talk about a really unusual agency that is a quasi-government agency that is not really funded by the government, but takes care of a lot of folks with medical needs and other special needs. It is the Community Services Board, and my guest is Sherry Hunt. Welcome, Sherry.
Thank you very much. Thank you for having me, Robin.
You know, I've had a tour of some of your facilities, and I think it's an unusual thing because you guys do so much, and for people who aren't using your services, the vast majority of folks out there have no idea what it is that you do. So I'm going to let you, if you would, give us an overview of what those services are and how they're paid for.
Oh, absolutely. The Hampton-Newport News Community Services Board is the premier provider of behavioral health, substance use disorder, and developmental disability services for Hampton and Newport News, Virginia. Now, we are the second largest CSB in the Commonwealth of Virginia. Now, CSB is Community Services Boards, and basically the CSBs were designed to offer services and supports to individuals with mental health challenges, with substance use disorders, and intellectual and developmental disabilities. We're also unique in that we were one of the first CSBs, or Community Services Boards, to be created in the state back in 1971. Now, we're second largest because of our wide array of services that we provide and programs that we provide, also because of the number of individuals that we serve every year and the number of staff that we have. So the Community Services Board is here when you need us. We're located right here in the city of Hampton, 300 Medical Drive. We have our main campus, but we also have ancillary locations throughout Hampton and Newport News, Virginia, offering the very, very valuable services to the community.
Well, so let's talk about then, you do provide this huge array of services, and I think people may know one of those, but not realize all of them. So as far as the overview, what originally, I think mental health was kind of one of the impetuses for the founding of these boards across the state, and the state, deemed that it would do it. And I think some of that original impetus was, at that time, a lot of people were being sort of warehoused in giant mental health hospitals, and people realized that wasn't necessarily the best way to treat them or the most economical way to treat them. It wasn't producing the right outcomes.
Sure.
So treating them in their community in a different setting was going to be more effective. So what do you all do in terms of mental health?
Well, let me start by saying we serve about 15,000 individuals every year.
Holy, that is a lot.
Yes, yes. And 41% come from Newport News, Virginia, and about 38% from Hampton. Now, the other 21% are the individuals we serve through our regional programs, because we operate several regional programs for the state. But yeah, that's a lot of individuals that we serve. And we offer a wide array of services. We have 900 employees, that's full-time, part-time, on-call, volunteer, and interns. And we have a very, if you want to say, extensive clinical staff, including 12 psychiatrists and primary care physician, and a slew of other licensed professionals such as RNs, LPNs, licensed clinical social workers, etc. But in terms of the services that we offer, it's a very comprehensive set of services across a continuum of care, which includes prevention services, outpatient services, integrated care, day support and treatment services, residential services, and also acute inpatient. So it's a very wide, comprehensive system of care.
That is also really unique in that I think a lot of times care can be very segmented. You can go to a counselor, and sometimes that person may or may not be affiliated with a psychiatrist or someone who could prescribe medication, and sometimes that may or may not be connected with an inpatient, and so people can, not have an integrated system. And with yours, it is very tied in and comprehensive. And a lot of times, too, people have overlapping issues. You may not just have a need for counseling, it may be tied to substance, or it may be tied to a trauma that's happened in the past. These things are not easy and simple, right?
Absolutely, and we specialize in integrated care. In fact, we partner with the Southeastern Virginia Medical System. They actually have a clinic located directly on our campus, so they're co-located with us, and we offer integrated primary and behavioral health care on site. We also have a pharmacy on site, Genoa Pharmacy. We partner with Genoa to provide pharmacy services not only for the individuals we serve, but for the staff located at our site in Hampton. So yes, it is an integrated system.
I mean, I'm asking you a speculative question here, but if you weren't there, all of these folks, some of them could get care from private providers, but it would be a completely piecemeal, difficult system. Like, you're sort of irreplaceable, aren't you?
Mm-hmm. Definitely. We like to think so. We specialize in coordinating care across all of the issues that an individual may have. We have a coordination of care. We have case managers that will coordinate. As you said, an individual may have a mental concern or a mental challenge, but also a substance use disorder. So they have a co-occurring disorders. And so we have case managers that will coordinate that care and make sure the individual is served accordingly.
Now, who pays for all this? Because this sounds very expensive, Sherry. I don't know. As a taxpayer, I'm a little worried.
No. 60%, about 60% of our revenue is fee-based, which means that we charge Medicaid and we receive fees from Medicaid and other insurance. And then the others, part of that is basically some state funding, about 12%, some local funding, a little under 10%, and then other sources such as federal grants and things of that nature. But no, it's not all taxpayer funding.
And I have to think, too, that you guys have probably grown a lot since the healthcare world changed and people had, I won't say universal health care, but at least more people had access to health care, and it was mandated to include mental health and substance abuse, at least if you were under, the Obamacare policies or Affordable Care Act, as I'm supposed to call it. Because before that, a lot of people didn't have insurance that would cover these kinds of things.
Absolutely. And we're so excited that a lot of our services that we provide are covered by most, if not all, insurances. And particularly with Medicaid expansion, we're excited that more individuals will qualify now to receive Medicaid insurance because Medicaid does cover all of the services and supports that we offer.
And I do want to remind people, when they hear Medicaid, a lot of times they think of people who are not working. The expansion is covering basically people who are working but who only make minimum wage or who have not been able to find 40-hour-a-week jobs or jobs that provided benefits. So it is
Correct.
Truly covering working folks.
Correct.
By and large and families. So that's, a big pocket of need there.
Absolutely.
No, go ahead.
And I'd like to tell you about another service that we're extremely excited about that we just recently started to provide, and that's called Rapid Access. And that means with Rapid Access, an adult or a child that has a mental health issue or a substance use disorder can receive a same-day assessment and then be referred for treatment on the same day. So in the past, you've had to call in and make an appointment to receive an intake appointment, but now you can actually walk in on the same day, and these are for individuals that have not yet been seen by the CSB. So if you're currently not a client of the CSB, you can actually walk in same day, do all the registration, receive a clinical assessment, and then be referred for services, whether it be therapy services or case management, and you will receive an appointment for those services in 10 days. So we're extremely excited about this new service that we just started offering in January.
Why is that so important?
Well, it's very important because it's rapid access to care, and it's same-day access, and it's something that the system is moving toward because the system, the Commonwealth of Virginia, is moving towards system transformation, excellence, and performance. And one of the steps included in that step, Virginia, is same-day access. In fact, that's the first step. And so it's very, very critical that individuals get the care that they need when they need it. And so by our CSB, Hampton-Newport News, providing rapid access, we are meeting the need in that regard.
I think there's still a stigma in society about reaching out for mental health care or going to counseling, and some people at least still are reluctant to do it, and they kind of wait until it's at this critical point. And then if they reach out and they can't get in anytime soon, they get discouraged, or they don't come back, or they're already at a crisis and things are falling apart. And this could really help, kind of sustain folks during that time. It's a great idea.
Absolutely, absolutely. So we're very encouraged. And so far, like I said, we started this January 2nd, and so far we've seen 60 individuals through the Rapid Access Program. So we're very, very excited about this.
I think, too, once people decide to seek treatment, there's a window, and, if you can get them in that window, you get them while they're ready, and then, their initiative might wear off, or that whatever prompted them to come forward, it's not, I'm not as much pain today, I'll just ignore it for a while again. So
yes.
You've got them in the door, and you've got them on the path to treatment, which isn't an overnight answer.
Absolutely, absolutely.
And it takes a lot of commitment and a lot of time.
Yes, definitely.
So, Sherry, if people are listening to us and thinking, I've never heard of this, I didn't know that I could get help, what do you want to tell them? What are the steps to take?
Well, call us. We're available. Our administrative hours are 8:30 to 5. We can be reached if you go to our website. It's hnncsb.org, and it has all of the information in terms of the numbers to reach us during administrative hours. But we also have a 24/7 emergency hotline number for those that are in a crisis, whether it's a mental health crisis or a substance use disorder crisis. And we have a crisis stabilization center as well. And again, all of that information is included on our website, along with information on rapid access and the days and times in which individuals can walk in and be seen for a clinical assessment. So again, it's all there on our website.
And who is your target audience? Who are you talking to?
Everyone, anyone throughout Hampton-Newport News, primarily are the individuals in those communities that we serve. So anyone that's in need of our services, again, around mental health challenges, substance use disorders, and developmental and intellectual disabilities in those communities.
So it could be people on Medicaid, it could be people with private insurance, it could be people without insurance, because we know there are still people who have gaps in their coverage in our community.
Absolutely, and actually we've served individuals without insurance. We served about 4,000 individuals without insurance, and that's year over year pretty much. So we do not turn you away because of your inability to pay. We work with you to determine your eligibility for any services and supports or insurance to make sure that you're set up. But again, we do provide services to those that are not insured.
Amazing. And I think, too, people who have private insurance might think, that's just for, people on Medicaid or people who can't pay. But you do serve people with private insurance as well.
Oh, absolutely. Absolutely, yes. Mm-hmm.
And again, your array of, not that there aren't wonderful private services out in the community, but you have that wraparound.
Correct.
And a huge array of people to sort of target folks to the best source. You've got so many therapists and physicians and other people on staff.
That is correct. We're very, very proud of our staff.
Okay, well, is there anything else you want to mention that I haven't asked you about, just as far as this overview? Because I do want to delve into some of the services on a deeper level later.
Oh, yes, absolutely. I just want to talk a little bit about our addiction, recovery, and treatment services.
Okay.
We've expanded those recently. As you know, the opioid epidemic is something that we all are facing as a community, as a country, and we've expanded our opioid abuse services through our addiction recovery treatment programs. We have a methadone clinic in downtown Newport News. It's called Hampton Roads Clinic, that offers medication-assisted treatment for those with an opioid use disorder. We also offer medication-assisted treatment through an office-based opioid treatment program at our main campus. It's a different medication. It's Suboxone. But again, we have a lot of services and supports for those that are suffering from addiction. We also have a very unique program It's a residential program for pregnant women who are addicted to drugs or alcohol. And they actually can come into this program. It's a 16-bed facility. It's called the Southeastern Family Project. It's in Newport News. And they actually can come in and receive treatment for their substance use disorder and have their infants with them through this program. So it's a wonderful, wonderful program.
That is amazing. And I think, I would like to talk more too. The treatment of substance abuse has changed so much, and I think in earlier decades it was like, well, just go get yourself clean, do it, cold turkey, sorry, the treatment is just to stop. Right. And that's, with a physical addiction and usually with underlying reasons for someone looking to mask their pain or whatever. There's a whole lot of complexity there, and a lot of people couldn't just stop. And medications to change that have really changed the treatment and made
Absolutely.
It's still not easy, but for people who really want to change their lives, there's a whole lot of new ways to help them do that. And I don't know that people out there understand that.
Yeah, absolutely, absolutely. And we have a multitude of services under the ARTS umbrella, or Addiction Recovery Treatment Services. And again, all of our services that we provide are person-centered. So we make sure that it's the individual that kind of drives the decision in terms of how they receive care and how their treatment proceeds. And again, in dealing with medication-assisted treatment, it works for some, and it may not work for others, but there are other type of supports that would work. But everything that we do is person-centered.
And the other thing, we touched on it just a little bit at the beginning, the fact that you are a very large board and that you're serving 2 localities allows you to have, in a cost-effective way, some special programs like the residential center for pregnant women, because if it was 2 separate boards, separately funded, you might not be able to stretch those dollars to have those targeted services. And that's just a great way to maximize everything that you do.
Oh, absolutely, absolutely. We're thankful also for the support of the local government. They support us, as well as we receive support from the state entity, the Department of Behavioral Health and Developmental Services. But again, the majority of our revenue is from fees that we charge the individuals that we serve. But we are thankful for the support.
Well, when you think about it, and it's hard to measure sometimes in dollars or in community benefit. But when you look at a baby born to someone who is able to not be addicted during their pregnancy, or to get clean, the health of that child and what you save in that child's birth and early medical care, and brain, cognitive, all the things that you've saved in terms of community cost or cost of the health system or whatever.
Absolutely.
That's huge. And the same thing with adults with intellectual disabilities or physical disabilities who can't be housed. Their parents are aging. They need care. They've grown up here. You're putting them together and helping them, live adult productive lives. There's just so much that is a community benefit, and that's why it's a community services board. You're helping individuals, but in helping individuals, you're benefiting the entire community.
Absolutely, you said it best, Robin.
I'm a talker. I'm
absolutely,
sorry.
Absolutely, and to your point, we do have waiver group homes and intermediate care facilities and other type of homeless. We have a very comprehensive array of homeless options, or home options for the homeless, as well as I mentioned, these waiver group homes, et cetera. So very, very comprehensive in that regard.
All right, and we're going to have more folks back to talk about in depth some of those services right here.
Absolutely.
Well, thank you so much, Sherry.
Well, thank you for having me.
And thank you for watching. I hope we haven't been able to tell you every detail of everything they do, but you have a general idea of all the services that are out there. And if this is something that you would benefit from, or somebody who would benefit from, don't wait. With the rapid access, you can get in quickly, you can be treated and get some things rolling to help your mental health or anyone that you know to start on a better path. Thanks for watching.